Hello, everyone. Today, we are going to be presenting to you the perceptions of healthcare providers on translator-mediated care. The authors of this project is myself, Brianna Rubenstein, Alexandra Ortiz, Sarah Mano, Olivia Keller, Dr. Miller de Rute, and Dr. White.
Our study looks at the use of translator and interpreter mediated care by healthcare professionals. In our study, the use of translator mediated care refers to written communication, whereas interpreter mediated care refers to the use of oral communication. During these times of COVID-19, it's of the utmost importance that both the healthcare professional and the patient are able to communicate effectively. And current research shows that there's a lack of confidence between both the patient and the healthcare provider in the quality of care that's both given and received. So we hope to look into this existing system of translator interpreter mediated care by conducting semi-structured interviews with healthcare professionals who have interacted and given care to patients who speak a language different from their own.
This is a unique research because there's not much literature or journals on the exact themes and topics that we are touching. Past research has found a higher dissatisfaction rate during patient care when providers don't speak the same language as their patients. Many factors, such as not having healthcare, not speaking their predominant language, citizenship status, limited transportation, all these factors negatively affect the patient satisfaction when seeking healthcare. Sometimes using an interpreter makes the patient feel unheard or misunderstood, and that is why these satisfaction rates are higher. If the provider were from the same country or spoke the same language, the quality of care perceived from the patient will be increased significantly.
After the conduction of our literature review, the next step in our project is to gather participants to interview. So healthcare professionals are currently being recruited through email to schedule virtual interviews that will be conducted over Zoom using transcription software to facilitate the process of recording responses. The format of these interviews is semi-structured, which will allow the healthcare professionals to elaborate on their responses and experiences. However, we do have a list of questions prepared, and a sample portion of those are on the poster. A goal of ours is to hold 50 interviews or until the data saturation is reached. And at that time, the interview transcriptions will be analyzed qualitatively in order to group together common words, phrases, categories, and themes. And after that is done, the data will be coded using NVivos and analyzed quantitatively using SPSS software for both descriptive and inferential statistics.
Within our literature review, we were able to draw some results from what the previous literature had published on our topic. So in regards to women, on one study, which was 75%, a sample size of 15 women, it was reported that discrimination in their ability to speak English discouraged them from seeking medical treatment. And along the same lines, within the same study, it made women who were patients feel ignored and overlooked by their healthcare provider because of their language barrier or Hispanic ethnicity. In another study, it was suggested that men who experienced a greater perceived ethnic discrimination were less likely by 4% to be screened for colorectal cancer. Although we have not yet drawn conclusions or conducted our interviews for our research project, we expect to see some of the following results within our study. We expect that healthcare professionals of our study will suggest that there has been limited ability to treat these patients and maybe even lack of follow-up appointments. Additionally, they may have experienced misdiagnosing patients or having lower patient satisfaction rates, and even on the side of the healthcare provider, feeling as if they had not properly done their job or really given the best of their care to their patient.
We would like to thank the University of Tampa's Office of Undergrad Research and Inquiry for giving us the opportunity to conduct this research.